This is your 10-Minute Tuesday. I'm Dr. Kerry-Ann Williams, and Black Mental Health Matters is a podcast about mental health in the Black community and beyond. Check out my last episode for the first 3 reasons that I have heard for why people don't take psychiatric medication. There is this idea that, as human beings, we should be able to manage on our own without medication. Otherwise, what does that say about us? And it's that question. If you're on a psychiatric medication, what does it say about you? The way that you answer that question will help you to understand your core belief about mental health treatment as it applies to you personally. So in this mini episode, I wanted to share a few more reasons that I have heard from patients and people in the community. So let's get into it. Reason number 4, it's not worth the risk of getting side effects. This is called the risk-benefit ratio. Most patients understand that all medications have potential side effects, so they start to assess when it's worth risking the side effect to take the medication. So it looks at something like this. Diabetes, yes, really important to take the medication, worth the risk of side effects. Heart disease, yes, really important, worth the risk of side effects. Depression, depression. Well, can't I try to fix this myself? I'm not sure if it's worth the side effect risk to take medications for this. Isn't there another way? I'm just not sure if it's worth it. But I would like to ask, is the suffering with depression worth it? Is the continued self-medication with alcohol to try to treat the depression worth it? Is the side effect greater than the benefit? Is the side effect temporary? Is the side effect reversible? Here's an example of a risk-benefit issue. ADHD medication for children can sometimes reduce appetite. The child may be benefiting from the medication, so should we continue the medication if it reduces appetite? In this case, if the medication is making a difference and it's helpful for the child, then we can try to work around the side effect. So if it lowers appetite, then we can give the child breakfast before giving the medication in the morning. And then you can have a big dinner when the medication wears off in the evening, because this type of medication wears off after a certain number of hours. Reason number 5, I tried a medication before and it didn't work for me. Have you tried a medication prescribed by a psychiatrist and had a bad experience? Sometimes that happens, but I have some follow-up questions. First, did they have the correct diagnosis? Sometimes a medication fails because it's treating the wrong thing. Maybe the medication didn't work because you never got the correct type of medication for your diagnosis. Second, did you have the right dose? A dose that is too low can be ineffective, and that is frustrating. A dose that is too high can lead to problematic side effects. Medications should be gradually increased and not underdosed. Third, when you first started the medication, were there clear expectations of what the medication could and couldn't do? Sometimes it can feel like a medication plan is bad because a doctor didn't explain how long might it take the medication to work, what dose is a therapeutic dose, and in particular, which symptoms are going to improve. This is important because you might be expecting a medication to provide symptom relief quickly when the medication may work by just reducing the intensity of the symptoms and not relieving you of them. Last question, did you have an unbiased third party comment on whether or not they saw a change in you after you started taking the medication? Sometimes it can be difficult for us to see changes in ourselves. Sometimes you may think a medication is unhelpful, but a trusted friend or partner can notice the improvement. Reason number 6, I don't want to get addicted. This is one where I notice people define addiction quite loosely. They may be referring to dependence in a general way. So if they feel like they have to rely on a medication to help with their mood, that means that they are dependent on it. I generally explain to patients that there is a difference between drug addiction and medication treatment. Taking a medication to treat an issue is not the same as addiction. So yes, you are relying on the medication, but in the same way that you rely on an antibiotic to treat an infection. Reason number 7, marijuana makes me feel better than prescribed medications. I hear this from time to time from patients who use marijuana. Teenagers tell me that marijuana is, quote, natural, and prescribed medications are not. Therefore, marijuana is safer. Is it safer? I'm not saying that prescription medications solve everything, but there is a lot of study and thought behind physician recommendations. And what I see most commonly is a minimization of the potential risks of marijuana compared to prescription medication. And often what it really comes down to is the core belief question that I asked at the beginning of the episode. What does it say about you if you take psychiatric medication compared to what does it say about you if you smoke marijuana? And what is the difference in the answer? In addition, self-medication thrives when we feel like we don't want help from others, or that we shouldn't need help from others, or also when we feel like we're not getting enough help from others. With self-medication with marijuana, we can justify any risks that we become aware of because in the risk-benefit analysis, not depending on others is a highly valued benefit that outweighs the risks. Reason number 8, doctors feel like they have to prescribe medications. It keeps them in business. Have you guys heard this one? I heard this one once from someone in a bike shop. Some people don't take medications because of a philosophical and perhaps slightly paranoid belief that doctors need to keep patients sick in order to stay in business. The truth is that doctors get a lot of personal satisfaction out of solving medical problems and having patients get better. It would actually be better for business if doctors could fix everything. I wish patients didn't have to be on chronic treatments, but we don't have better solutions for many things yet. Health is complicated. Researchers are working on solutions. Life isn't perfect. And psychiatrists don't always prescribe medications. And that's it for today. You've been listening to Black Mental Health Matters with Dr. Kerry-Ann. This episode was part of a 10-minute Tuesday series. If you found anything helpful today, make sure to share this episode with others. Take care and have a great week.